In the following lecture, we'll be discussing fractures. This is a very important topic in pre-hospital trauma management. It's important that all first responders know how to manage fractures effectively.
Namaste. Today we'll be discussing fractures or bone injuries, which are very common in the trauma setting. It is crucial that first responders know how to stabilize fractures as they can lead to long-term disability. Now let us begin to discuss this in more detail.
So a fracture is essentially a break in the bone, and these can be characterized as either closed or open. With closed fractures, the broken bone ends do not penetrate through the overlying skin, but with open fractures, the broken bone ends do penetrate through the overlying skin. So these tend to be associated with increased blood loss and increased risk for infection. Rib, thigh, and pelvis fractures tend to be the most severe, so these require immediate attention. Improper management of fractures can lead to a variety of complications, and these include damage to surrounding soft tissue structures, nerves, muscles, and organs, increased bleeding, increased risk for permanent disability, an increased likelihood that a closed fracture becomes an open fracture, and increased pain. So it's important that first responders are able to recognize fractures. So the following are signs and symptoms that are associated with fractures: deformity and angulation, tenderness, swelling, and pain at the fracture site, swelling, bruising, and motion where no joint exists, crepitus, which is a characteristic sound, crackling sound or sensation that broken bone ends make upon palpation, pain and weakness in motion, an abnormal pulse, skin color, temperature, motion, and sensation beyond the fracture site, internal hemorrhage and shock, especially with pelvic and thigh fractures, and shock with open fractures because these are associated with increased blood loss. So in terms of management, there are a few key principles. Number one is to control bleeding and to cover open wounds and exposed bone ends with open fractures. Immobilization of fractures is very important, and then to initiate rapid transport to the nearest healthcare facility. Immobilization is a key aspect of management, and the reason why is because it minimizes further damage, it decreases pain and discomfort for the patient, it reduces bleeding, it aids in transport, it decreases the chances that a closed fracture becomes an open fracture, and it aids in the healing process. So this process of immobilization is known as splinting, and it involves securing broken bones to a rigid supportive base. The materials required to splint include a rigid base, padding, and strips to secure the splint. In the image shown on the right, we have a femur fracture, and you have a splint that is used to immobilize this fracture. The key aspect of splinting is to immobilize the joint above and the joint below the fracture. So here, with the femur fracture, you can see that the splint extends beyond the hip joint and below the knee joint. So in terms of general principles of splinting, number one is to expose the fracture site and to remove all jewelry. And then you have to ensure that the splint is the correct length. It must immobilize the joint above and the joint below the fracture. So here, with the lower leg fracture, you can see that a splint should immobilize the ankle joint and the knee joint. 2 splints can be used to secure the limb as well. Splints must be padded because this allows for greater comfort for the patient, but also increased immobilization. And then you can secure the splint using strips of cloth or bandages. Again, 2 splints can be used to provide increased stability. Additional points to keep in mind include that more padding can be added inside of a splint to reduce movement of the limb. Limbs can be elevated, and ice or cold packs can be applied to reduce swelling. Pulse, motion, sensation should be evaluated regularly when splinting, just to ensure that the splint is not cutting off circulation or causing more damage. So from now on, we'll discuss a few characteristic or important fractures, and the first is the upper arm fracture. And signs and symptoms include pain and tenderness of the area and an inability to move the arm. Management, again, is to first apply a rigid splint, such as the one depicted, And to stabilize an upper arm fracture, you have to ensure that the elbow and the upper and the shoulder joint are immobilized. So here you can use, like for example, a rolled up newspaper and bend it such that the elbow is supported and that the length must extend above the shoulder. And then you can apply a triangular sling for greater stabilization, for greater stabilization of the arm. And this is how a triangular sling can be applied. You can also use a swath. This just involves using 2 strips of cloth or bandages, so it's a little bit different, but again, it allows for the same function. It immobilizes the upper arm. And this is how this can be applied. Thigh fractures tend to be very severe, and its common signs and symptoms include pain and tenderness of the region, deformity, so the foot is usually rotated outward or the leg appears to be shorter. Angulation is very common. Patients often complain, patients cannot move their legs, and you have signs of internal bleeding. So in managing a thigh fracture, you need to ensure that the knee joint and the hip joint are immobilized, and this is how a splint should be applied in this case. It's important not to secure the splint over the fracture site, so that area should be avoided. And as you can see here, the hip joint and the knee joint should be immobilized. Pelvis fractures are also associated with very severe complications, and common signs and symptoms include pain, especially when walking or standing, and pain in the region of the pelvis, the hip, the lower back, groin, and abdomen region, movement of the pelvic bones upon compression, numbness and tingling in the groin and the legs, and signs of internal bleeding. So management involves application of a pelvic sling, and this helps to not only immobilize the pelvic bones, but it also helps to control bleeding to a certain extent. Before applying this, all belts and materials from pockets must be removed first. And this is how it should be applied. It's essentially a tourniquet. And this is just securing the rod. It just needs to ensure that the rod, the Titan rod, is secured in place. Rib fractures, again, are very severe, are associated with very severe complications. And so common signs and symptoms include chest pain that worsens with deep breaths, a crackling sensation when the rib is touched, and pain at the fracture site with increased pressure. But management really just involves rapid transport to the nearest healthcare facility. The patient's arm can be repositioned and secured against the chest to provide more stability, and ventilation assistance can be provided if necessary. But it's important never to immobilize the entire chest from expanding. So first responders should not, wrap a bandage around the entire chest, because that can compromise breathing. Flail chest occurs with more severe fractures. This occurs when multiple ribs are broken in more than 2 sites along their length, and this leads to an independent fragment. And so essentially this damaged area moves opposite to the rest of the chest during breathing. Management just involves applying a bandage or something to just stabilize that independent fragment and ensure that it's not moving in the opposite direction. Again, it's important not to wrap padding around the entire chest, but rapid transport is key because definitive treatment can only be provided at a healthcare facility, and breathing support should be provided if required. Children tend to be less likely to incur bone and joint injuries. However, if they do, they have a tremendous risk for permanent disability as they are still growing. So it's important to address these effectively in children. The management process is the same as in adults. Communication is essential in pre-hospital trauma management. So there are several points that first responders must always communicate to the subsequent care providers, and these include the mechanism of injury, the status of the vital signs, airway, breathing, and circulation, whether it's an open or closed fractures, the original position that they found the broken bones in, motion and sensation, the motion and sensation, the color, temperature of the splinted area and beyond before and after splinting, and events during transit. So what were the progression of injuries, what were the interventions that the first responders performed, and what were the outcomes of these interventions. So the required materials and equipment include gauze and pressure dressings to control bleeding with open fractures. But splint materials include a rigid base that has to be long enough. Tree limbs, branches, umbrellas, rolled up newspapers can be used as a rigid base. Soft padding is required. You can use towels, clothing, even grass and leaves for this, and securing materials such as bandages or strips of cloth. To summarize, all fractures must be immobilized through a process known as splinting. It's important to immobilize the joint above and the joint below the fracture at all times. If a fracture is severely angulated, first responders can attempt to straighten it as much as possible. However, if the patient is in too much pain or there's too much resistance, then the fracture should be splinted in the position found. Rapid transport is key, especially for thigh, pelvis, and rib fractures. And it's important to remember that pulse, skin color, temperature, motion, and sensation of the fracture site and beyond should be frequently evaluated.
I hope you have found this presentation useful. Now it is time for you to practice these skills so you may be better prepared in an emergency situation. Please feel free to ask any additional questions. Thank you for your attention. Dhanyavad.